Hi, my name is Kentoria Roberson White. I am a family nurse practitioner and I am the women's health provider here at the South Dallas location. As a women's health provider, I get asked a lot of questions. Some of the questions that my patients come in asking is, where can I get birth control? Are my periods normal? Is the HPV shot recommended? And also, what is PrEP? So there's a lot of misconceptions surrounding birth control and HPV. A lot of people think that in order to get the HPV vaccine that you have to be sexually active, when in fact we want you to get the vaccine starting at the age of 9 to prevent you before you start becoming sexually active. And when it comes to birth control, it's like wearing a seatbelt. We want to protect you before you become active, but also you don't have to be sexually active in order to get on birth control. Birth control not only helps with pregnancy prevention, but also menstrual irregularities. So when you go to your next appointment, ask your provider about HPV vaccines, HPV status, and how they test for HPV. In regards to birth control, here at Prism Health North Texas, we partner with the local organization named Trust Heard. And with that partnership, we're able to provide free birth control for those that qualify. In the African American community, we don't talk about preventative measures, for example, PrEP. So it's very important with the rise in HIV cases that providers talk to their patients about PrEP, especially Black women. Historically, HIV was viewed as something that only was contracted through same-sex relationships. New research and information is showing us that the cases among Black women in heterosexual relationships are on the rise. This is why we should use preventative measures from the virus. The H in HIV stands for human, which means that anybody is at risk for contracting HIV. To protect yourself and your sexual partner, it is very important not only to use condoms, but ask your provider about PrEP, not only to help you, your partner, but others around you. In regards to mental health, there's a lot of stigma and a lot of people avoid mental health conversations. It's very important to me and the people surrounding me that we go out and we seek these resources. Prioritizing mental health is very important, just like you prioritize going to the dentist and going to your regular scheduled programs. It's a solid foundation for all areas in your life. So one of the providers here gave me a great saying in regards to mental health. You can't pray away mental health. Just like with diabetes, you take your medication and you pray, and that's how we should view mental health. Together, all of these tactics help foster a better mental health. So a lot of patients tell me, Kentoria, I just don't have time to go to the doctor. In order to take care of our families, it is very important for us to take care of ourselves. As Black women, we prioritize paying bills and take care of our family. And as a result, a lot of diseases and infections go untreated. Just like when you're on the airplane and they tell you to prioritize putting the mask on yourself before tending to your children. That's how I want you to view your health. In order to take care of them, you have to be healthy and well. And in order to do that, you have to come into a provider. Earlier screening equals early detection. Historically, amongst Black Americans, there's been a lot of mistrust and abuse when it comes to the healthcare industry. And as a result, a lot of us feel inadequate and afraid to advocate for ourselves. Step 1 in advocating for yourself is finding a trusted healthcare provider that you can be open and honest with. Step 2. Go into your appointments prepared. Come in with a pen and pad and questions to ask for your provider. Step 3, follow up. Do the treatment recommended by your provider. Another benefit of following up and taking treatment is less time, less money, and less complications. To find us, you can locate us at phnTX.org or follow us on Instagram at Prism Health NTX.